Okay, good evening, everybody. I'd like to call the meeting to order. Jim, do you want to read the unusual?
Sure, this meeting is being recorded via Zoom and will be uploaded to CTSB. We'll make every reasonable accommodation to get everyone into the room. And this is the December 13th, 2023 Tri-Town Boards of Health meeting in person and with a hybrid Zoom option.
We have the minutes from the previous November 1st, 2023 minutes. May I have a motion to approve those minutes?
So moved.
Second. Thank you. All in favor?
Aye.
Aye.
To the next item is the Tri-Town Health Department budget presentation. Jim is going to do that. Jim, do you want to take that?
Yes, give me 1 second. Let me do a screen share. If this actually works the right way after practicing 30 times today. Great, good evening. So everyone, this is our annual fiscal 2025 draft budget that the Tri-Town Boards of Health have to either hopefully approve and then move on to the 3 towns. And so I did send it out to you a while ago, and I'll just do my best to briefly go through the budget presentation. Please interrupt me if you have questions as I go through the budget. It's a pretty straightforward budget. So that's that. So the budget, you'll see the numbers that we send incorporates routine cost of living increases. We typically budget between 2 and 2.5% cost of living for employees, as well as we also budget an additional 1% to help employees keep their credentials and make it, equitable and fair and whatnot. What we typically do, since the town of Lee is our fiscal host, it takes a while for Lee to figure out the insurance and the retirement percentages and so on and so forth. So what we will typically do is on this budget, we'll level fund what was budgeted for this fiscal year for FY24. More likely than not, it's going to go up this year. It seems like health insurance was relatively flat the last couple of years. And so we probably anticipate an increase in the fringe benefits. So what we'll typically do is, assuming, so I'm just trying to get at the same time. I can't, my mouse thing. It's Clarence Fanto. Sorry about that. Sorry for the clunkiness. We'll wait to see what Lee comes back with, and we'll send modifications. And there's a lot of it that goes back and forth until March or April, but I probably anticipate that the fringe benefits will go up. All the other line items are pretty much level funded, and Lee pays 33%, Lennox pays 43%, Stockbridge 24%. For those that are relatively new and how we got to that number, many moons ago, if this board remembers, it was all based on population. It wasn't fair, it wasn't equitable. So we entered a long ordeal of reviewing our financial paradigm. And what we do is we we inventory everything we do, from permits, complaints, to septic, to housing, to restaurants, all the way across the board. And then we did a 3-year rolling average, and this is the percentages that come up. Even during the pandemic, when a lot of places were closed and some services were kind of suspended, the percentage is still, for some rhyme or reason, still pretty much comes out consistent. And we continue to look at that because we want it to be fair and equitable, but this is sort of like what the demands are for the towns. I consider this a maintenance budget. It's sort of like paying for pay raises, cost of living, but everything else is in really good shape. 3 things that we're going to really look into soon is we're in the process of exploring vendors to convert 90+ years worth of Tri-Town records to a more digital cloud format. We're doing this for a lot of reasons. We're not town clerks, we're a health department, but we have all these records. We have records on the first floor, and we have an attic overflowing with records that we have to go through. And public records requests continue to be a challenge for us. Zach handles that. It's 6 to 8 hours, multiple days away from his regular duties. We can't backfill it. It's becoming a challenge. And as we start to think about the future home of Tri-Town, for those that aren't aware, Lee is in the process of trying to attempt to get funding for a public safety complex for fire, police, EMS services. And Tri-Town was at the table at the beginning, but we kind of got ourselves out of it because if Lee's going to spend $30+ million, it makes it very difficult for Lee to cover those costs for Tri-Town when we have other towns involved. So we're no longer part of that process. And if they're successful at their funding at town meeting, they're probably going to demolish the Aroli building. And I'm actually thankful that they will. This is a building we've been in since the late '60s, and it's not feasible for our organization anymore. But that will make us homeless to a point. And so we're working with Stockbridge and possibly Lennox on figuring out what's going to happen. More likely than not, it seems more feasible that we may go up to the old police station in Lennox. Nothing with Tri-Town will change. But with that, we have thousands upon thousands upon thousands of records that we got to figure out where to put. And it just makes more sense to go into a digital world, for public records requests and so on and so forth. So those are important things that we're looking at.
Once you go to the digital, you can just get rid of the other record?
Yeah, we would destroy
Right
them. So
away.
you get permission and destroy them.
Okay.
But I'll tell you, I'll get into it a little bit deeper, but we've had presentations with some vendors.
Mhm.
The technology is out of this world. They actually scan, they come out, they take everything, they package it up, they bring it to a warehouse, and they actually pay staff to scan every single document. Septic plans, well records, and there's a lot of things in these files that are probably not useful anymore. But a lot of these records, these are property records that have septic locations and they're really vital to, the homeowners. If we have a fire or there's a flood, we have archives going back to the 20s, and it's really important. And from a public record, so the way their platform works, say for example, we have one property file, but we have another property mistakenly in this file. Every scan is searchable. Every piece of word on every single scan is searchable. So we'll never lose records ever again. It'll be quick and easy to find, and it's something. But with that, there's a capital expense to do it, and then the ongoing piece of that. And all three towns seem to be in agreement. We met, I think, last week in agreement that we need to make this happen. And I'm actually looking at other possible opportunities. See, of course, if people are trying to get into the meeting while I'm trying to do a presentation at the same time. One second. When I'm on a presentation mode, I can't access the Zoom account. All right, so sorry about that. All right. Next, there we go. So a lot of information here. You'll see requested FY25. So this is the combined Tri-Town budget. This is basically all items into one line item, and then it gets parsed out. At the bottom here, you'll see 159,948. That's Lee's portion. But if we skip over to, it's basically everything is level funded. When you see the 122,870, it's basically, that's our fringe benefits. We just level fund it for now. Then we'll make adjustments later on. I have web permitting highlight, but there's no reason for that. It's just level funded. So this is the breakdown by town. You'll see FY24 currently budgeted. You'll see FY25 budgeted. It's a very nominal increase for the towns. It's probably the lowest request we've asked for in a very long time. Usually it's a lot higher than that, but we look at this as more of a maintenance budget. It's a relatively straightforward budget. A lot of traffic going on here, but basically this is all the revenue that we collected. We try to report on the revenues that we collected. We took a little bit of a hit compared from the previous fiscal year to FY23, because we're in FY24, so we're still collecting revenues. It's down just under 3%, but I look at that as a win, because when I look at the charts, we were pulling in a lot of revenue, then the pandemic hit, and we kind of flattened out, where we're starting to slowly stabilize. And although it's only like a 3% decrease, it's only a handful of, a couple of restaurants, a couple places don't have pools. It makes it look like we lost a lot, but we really didn't. I expect FY 24 and FY 25 to restabilize. Of course, we don't like to increase our fees, but when we did increase our fees pre-pandemic, they were so far behind compared to other towns, we kind of brought it back up. But it's something with inflation and costs and, salaries go up and costs for the towns go up. I think probably FY 26, we should probably look at making some adjustments, but that impacts the restaurants, that impacts the business sector. And, something that we brought up years ago, about 90% of what Tri-Town does is commercial. About 90%. So only about 10%, which is like housing, for example, tenant landlord issues. Most of in some septic work, private homes selling their houses with septic and septic permits, but about 90% of everything we do is on the commercial side. These are just charts. You'll see. You see how it went up. That's right around when we increased fees. And then the pandemic hit, and for obvious reasons, we're in a state of shutdown. And we kind of bumped back up a little bit in FY 22 and just down a little bit in FY 23. And that's just really because a couple places closed and some sampling and things like that, just make some adjustments there.
The surprise here is how almost precisely similar the graphs for each town are.
Yeah.
Does that suggest that as one town goes, the other goes in terms of,
Oh, so yes,
or is it inherent in how the data is gathered or calculated?
yeah, I think it's similar. So we have two types of revenue that we collect. There are certain so each town gets its own revenue back. So all permit holders in Lee gets back that revenue. There's a couple other pieces of services we provide, like for example, the laboratory. We have our own laboratory where we do our own beach testing, we do our own ice sampling, we do our own pools, and that's a revenue sharing mechanism. So we bring in one fund and it gets broken apart by the percentages. So each town gets its own permits back, and then there's a revenue sharing piece. So I think it really all depends, I guess, but they're very similar.
Yeah.
They're very similar. All right, so that's really the budget. I'll go through the presentation first, and if there's any other questions, I'll ask for support on that. So Southern Berkshire Public Health Collaborative, as the board knows, we're year 2 into that venture, where we're getting significant amount of grant funds to work with several Southern Berkshire towns that bring health equity and health services up to a minimum standards. Tri-Town Health District being the oldest health district, Tri-Town is still Tri-Town. Tri-Town's not going to change anytime soon, but Tri-Town is the mechanism and the fiscal agency that's supporting the grant to assist other towns. So we were getting $300,000 a year in year 1 and year 2, and we're talking, this is grant funding that's supposed to last a long time. Money has never been invested in public health other than at the local level through appropriations for Tri-Town. The state has finally invested significantly into public health, but they're just not going to send these kind of dollars to these towns when they're not even meeting their own minimum standards. There's a certain expectation of bringing towns up to a certain point. And Tri-Town has been thriving for years. Outside of a nurse program, we've been meeting minimum standards for a very long time because the towns are investing in that. But there are financial inequities in other towns. You go to a couple towns over, they don't have any staff. It's Board of Health members doing all the work that aren't even certified or trained to do it. And towns are budgeting $2,000-3,000 at town meeting, which is almost unheard of in our world because we've been doing this for a long time. There's so many inequities. So pooling resources together, sharing services, Tri-Town being the poster child for that. We're going on 96 years doing this, and we're almost at our 100-year anniversary in a couple of years. So we wrote the book on shared services, so we kind of know what we're doing. So during that process, the state committed $300,000, But then we had to get into this big exercise in year two where the state, before giving us more money, they actually wanted to see how towns were functioning. Are you doing septic inspections? Are you following up on complaints? Are you doing restaurant inspections? So there was an expectation that all these other towns had to submit documentation, camp inspection records. And we'll just say South County was not doing so hot. And so in a way, the worse the towns were, even though it doesn't make sense from a health perspective, the more money they're gonna give towns because they need the resources. So South County fared pretty poorly, and I think Tri-Town had to go through that exercise too. And we met all the minimum standards, so I think if you took Tri-Town out of that data, it would have been even worse. And so with that, they're committing an additional 215,000 on top of that. So now we're getting around 515,000 to support the collaboratives, which is great news for us in South County. We're year two into our comprehensive shared nurse program. Tri-Town is its own vaccine provider. Thank you to all the board members and Charlie being our medical director and signing standing orders for us to make all this work. With that, we have to purchase vaccines, but we have to buy vaccines. So we have a nice sustainable cycle now where this year in particular, we had to private purchase our COVID vaccines, which is around $120 a shot. We bought 500 plus the flu and the high dose and the egg free. We spent about 95 grand in vaccines that we administer to the community. Now we'll get some of that back, maybe all of it plus a little bit for the reimbursements. But then we take that money, we buy next year's vaccine. We just continue to move the cycle, not at the back on the backs of taxpayers. That's the breakdown of how many vaccines we provided. We bought 500. We used 486, and we donated a few to VIM down in South County to help the migrant families coming into town. 27 homebounds, we're hoping to bring that number up, but it's very difficult for Jill, being the only nurse, to go into towns, into homes that by herself. It's a safety issue. And so we're in the process of trying to hire an equity community health worker. Once I think that position is filled, we're going to start to really ramp up our homebounds because there's a need for that.
Can I ask you just a silly question?
Sure.
So say in the town of Lenox, I still maintain my nursing license. I'd be willing to volunteer to go with Jill if she enters.
Perfect, thank you.
I mean, is that okay?
It's absolutely, that's wonderful.
Okay,
But yeah, we can definitely do that.
all
Yeah,
right.
yeah, absolutely, yeah. See,
What towns does the Southern Berkshire Health Collaborative include?
oh, you're gonna put me on the
All
spot.
of them. I mean, not
So,
just the town and
so
Tri-Town.
Lee, Lennox, Stockbridge, Alford, New Marlboro, Sandusfield, Sheffield, Great Barrington, Otis, Monterey. I think that's everybody. Look, it's a more of a regional focus. It's Southern Berkshire County. We don't have all of Southern Berkshire County. We don't want to take on any more towns because I'm very cognizant of the capacity and not diluting our capacity. We don't want to be taking on all these towns with the same capacity. It dilutes the programming, it dilutes the function. We got to have the right capacity to do this kind of work. We have another outbreak and we have to do more things. We don't have enough staff to do this. So I've been advocating to DPH looking at the Tri-Town model. I mean, like we have 4 full-time employees for 3 towns. You don't want to take on 20 towns with the same staff because you're not delivering the quality of services that you need. So we're very trying to be careful on how we're helping these other towns, but they're feeding us a lot of resources and I think it's going to get better and better as time goes on. It's finally, the state is recognizing the importance of public health and finally investing in it. They have not done this because Massachusetts is very different compared to other states. Most states are county health departments run by the state and there's no local funding. Massachusetts, you have 351 cities and towns with 351 boards of health, all competing with each other they're competing with schools and fire and police and towns that may not be able to afford services. So it's very hard to build a public health program. We've never had it. And so this will help bring towns along.
So can I ask a question?
Oh, absolutely.
Yeah. There's 27 homebound vaccines. What's the projected number? What do they think?
I
it
don't
could
know. So what we're doing right now, Elias, is we're sort of relying on the Council on Aging staff within their network to identify people that they work with. And then they're giving those residents our information, and they reach out, and we kind of do our thing. I think South County has an aging population. While I don't know the homebound percentages, I'm willing to bet they're pretty high. But I don't know that information right now.
So COA would probably have an idea of people who are homebound and who might be susceptible to issues of
Yes.
loneliness, isolation, and have other compounding issues beyond the vaccine. So they're an avenue for assessing that and providing help.
Yeah. So there's a lot of things we want to work on as time allows. You know, we want to get more back into the matter of balance programming, looking at fall risk assessments and more of a comprehensive public health, you know, other than just vaccinating people. We want to get more into that, but you know, it takes a while to build this kind of stuff up.
But
But
can I ask a question?
Sure.
I'm wondering, correct me if I'm wrong of what I'm remembering about this, because this seems, you know, like a big expansion, you know, of a lot of, you know, the Tri-Town into the other county, but into the other towns. But as I recall, the reason that you did this initially, or you got involved in doing this, is it was, I think, the first or second month that we were into the COVID, after the state of emergency had been declared, and our visiting nurse service withdrew.
Public health nurse.
wait, they went bankrupt and went out of business.
Yeah.
Yes, we had no nursing support going into the epidemic.
Zero.
And so what Jim did, as I recall, correct me if I'm wrong, is you put together a grant funding idea, which incorporated these other towns, but also then brought the wherewithal, so the Tri-Town, which could only really afford to hire a 40% or 50% of the time nurse, and wasn't an available option, to make that kind of nursing service available through this coordinated funding with the other towns. Am I right?
Very close. What had happened was, officially the pandemic hit us in March of 2020. And at that time, Tri-Town relied on a part-time VNA service for bare bones minimal. The towns were paying pennies to the dollar. We had discussions before the pandemic of trying to look at that a little bit closer. A lot of towns did that because nursing services come at a premium and they don't get into public health. They work at the hospital for really competitive salaries that we can't afford. And so when the pandemic hit, Charlie's right, they fortunately went out of business, and they were also providing school services to St. Mary's. So we were planning prior to that to try to fund. We actually got commitment from the 3 towns that could find someone part-time. Then the pandemic hits, we have nobody, and we made it through the pandemic. It was very challenging, but one of the things I said to myself, which was a very challenging couple of years, like, we need to do better coming out of this pandemic. And as the COVID dollars and ARPA funding was moving its way through, that's when we started having conversations with South County towns, and through the Public Health Excellence Grant, we knew funding was coming. So I kind of reached out to all certain towns and said, look, let's work together on this. We have the infrastructure, we can do it. We're not trying to take you over. Let's try to improve public health. And so when we got the first round of grant funding, it was really focused on nursing. You know, we hired 2 nurses, now we have 1, some per diems, but like, we gotta do better, because like, we don't need a pandemic to teach us a lesson. Let's invest and be prepared for the next time. But yeah, a good summary, good recall. I can't remember what I did last week. So I kind of belabored that slide a little bit. Additional things, you know, other things we're working on. We have a pretty robust car seat program. We held a Lee event some time ago, and part of our staff now are working with the families being relocated into South County. They're in motel rooms. They don't have access to food. You know, Jane and Jill are working with the migrant families. We help with interpreter services. Mass Hire came out yesterday, and there were some challenges on interpreter services, so we brought in a Creole French interpreter to spend the whole day with families. But one of the things that we're seeing is that a lot of these families have no access to car seats. So we're gonna be reaching out to some agencies to see if we can get more car seats. You'd be surprised the demand of car seats. It's amazing. I mean, we see families pull into the Tri-Town parking lot with a 2-year-old sitting in the front seat. It's just, it's mind-boggling to me, the inequities of access to resources, and we're picking away and identifying it as time goes on, and I kind of talked about that, shared service manager. Jane Smith now is working for us full-time. She's taken a lot. I'm handling the finances and the grant deliverables. So she's the boots on the ground. You know, she's an RS. I can't thank her enough for everything she's doing, and a lot of good things happening. And other accomplishments, we talked about the revenue. You know, we should look at these for FY 26. We got some time for that. Household hazardous waste continues to be strong.
Jim, before we move too far past the public health nursing piece.
Yep.
In terms of Tri-Town's role, and demands on staffing, on your time, talk about that a little bit, because, you know, with 4 full-time equivalents, that's a little higher than we've run over decades.
Yeah.
So I imagine that's where some of the capacity, the ability to manage this now, significant collaboration and grant allocation. How are you doing that without,
Better.
and maintaining everything else you used to do?
So we have 4 full-time equivalents just for Tri-Town. You have director, Zach, John, and Jason has converted over to the grant, but we have some people helping us now to fill that void. And so I will say, like everything between the pandemic and everything we've taken on, it was a lot. To take on the Public Health Excellence Grant in year 1, getting the intermunicipal agreement signed, didn't have a coordinator. Jane wasn't around at that point. I took a lot of that beating on, a lot of hours, a lot of weekend, but that's part of my roles and responsibility as Tri-Town, is to get public health at a better place. But the silver lining is, even though I was taking a lot of that on, a significant lot, plus we have I haven't even talked about the tobacco program. I'm still,
Right.
I knew that funding was coming to relieve me of that pressure at some point. So it took a lot longer than I expected, a lot of sleepless nights, a lot of weekends, a lot of conversations, a lot of people stepping up. Now that we have Jane fully onboarded and Jill's fully onboarded, we have a couple per diem nurses. I won't say that the obligation and the workload for me has decreased on PHE. I'm sort of now at a point where I deal with the quarterly financial reports, make sure the budgets are good, make sure the contracts are signed, and Jane has taken all that on. So I can get back to what my regular duties are, making sure my board members are happy, the community's happy, we're meeting compliance. We have the right staff and the right amount of funding coming in now to make this shared service agreement with South County doable. So I went from here to kind of like there. So I'm back to having some sanity left.
I'm hoping and guessing that you are, but if you're not, suggesting, the sort of care with cost accounting when you have overlapping budgets and responsibilities. I'm primarily charged with Tri-Town responsibility for Tri-Town, and this is all stuff we want to do.
Yeah.
I'm not trying to develop a schism here,
Yeah.
but we have 96 years because gone at this with a sense of fiscal conservativeness that has been self-sustaining,
Yeah.
and importantly, and it also trickles down into a safety and a relationship with our member towns that creates trust. Each time we go for budgetary necessities, we can say we're stable, we're reliable, we're conservative. And so that's important to me and I suspect to us. And so I just, I want to express that sort of subjective call to action of caution with, getting too big or getting, forgetting that cost accounting expenses,
Yeah.
like simple as copying, some of those sorts of things, licensing fees, et cetera, employee expenses and education can get really expensive once you're into the realm of public health nursing and accreditations, et cetera. So enough said, just that point I thought was worth voicing.
Yeah, and that's something I went into this with open eyes, like, my number one I don't wanna parse out priorities, but my number one priority is Tri-Town Health. And so, but with that said is we're fiscally conservative because we're getting all these new resources in, so it's a little bit of a give and take.
Mm.
If we didn't.
Tobacco was like that.
Yeah,
too.
if we, we're financially and from a community perspective, benefiting from this PHE. We're 3-member towns out of 12. And if we didn't have a nurse program, we would have to go to town meeting and try to find the funding for Tri-Town. So in a way, creating this collaborative, being, sensitive to the Tri-Town priorities, we got a robust nurse program, we're a vaccine provider. Our 3-town residents are benefiting significantly on services because of this collaboration. Because if we didn't have the grant, we wouldn't be doing it. We wouldn't be doing flu clinics. We wouldn't be making vaccine revenue. We wouldn't be doing car seats, and we're able to move some of those costs and copying the minutia stuff costs into the grant. So the grant is absorbing any of those additional priorities and responsibilities for the collaborative. And Tri-Town's sort of like in a maintenance budget. So in a way, we're benefiting, but I got less than 10 years left. I'm retiring. So I'm on the other side of my career, but like Tri-Town's in the best position it's been in a very long time. I think we talked about that from a budgetary perspective, a staffing perspective, support from the community. We go to town meeting, it's relatively pretty smooth. We're responsive to the community, we're on call all the time. And so our services are getting more efficient and better. And one of the things we gotta be recognizable is we gotta try our best to retain staff. You'll see that in some of our slides. I think some of our salaries are still on the lower side from a competitive perspective, but like we're getting better where we were years ago. Because there's performance standards, there's mandatory credentialing coming out now. We're gonna have to start to think about long term, but yeah, points very well taken. Quickly, additional accomplishments, we still have our tobacco program that got increased. Our household hazardous waste collection still going strong. The board members that went defunct several years ago, we kind of grabbed it and that's back on track. That's 17 towns. Sharps kiosk program, we got the call responder, which we're gonna have to start looking for some additional funding resources for that. We're getting ready to hire an equity access coordinator, having someone that can help with the migrant families and interpreter services, making sure people have access to meals. And, I look at food insecurity in a different way than many people. We have, several families that were relocated into, in Great Barrington into motel rooms that don't have kitchens. So someone dropping off groceries at the door, does that mean in my world they have access to food? So, when the state, I'm advocating with the state, we're working with Fairview and Heather Barbieri and Jane and Jill are doing a lot of different things. Like I'm really concerned, the state is moving a lot of these families into areas where they have nowhere to go. It's not like we have an Uber system. We don't have a robust taxi system. They don't have a kitchen to use to cook for themselves. And people don't want, pizza delivered to their door, of a French Creole background. Like people need to provide for themselves and have access to necessities. So we're having, I think, a community health worker will help us, get better at what we're doing in the community. The foot care thing is still, things are up in the air about that. Councils on Aging are paying out of pocket for foot care, nursing, and a lot of the foot care nurses are retiring, and it's getting really expensive. So I'm looking for some grant funding for that to support the Councils on Aging. Well, then I got the last one, obviously Tri-Town's role on, advocacy and related to the UDF are things we're working on. Real quick, high level priorities, continued response to COVID. Yes, COVID's still here. It's not gone away, regardless what people say or think. The reported numbers aren't reflective of what's actually going on in the community. A lot of PCR tests aren't being done anymore. Example, I had a local school call me thinking that they had some type of outbreak, and then we looked at the case counts for that town, they were at 4. It's not really reflective. We are getting a bunch of home tests. We're sending them out. Jill, she does contact tracing to a degree, but it's not like it used to be. Workforce credentialing, we're paying attention to that. We're very blessed to have good staff. We're retaining staff. Everyone's been with us for quite some time. We don't see a lot of turnover. And then try to expand some programming and maximizing our relationships with agencies. And that concludes my presentation. Do any, if I can see the stop screen share. Any questions from the board on the budget?
Not a budget question, but I've got a question on the implement regional prescription drug take back.
Sure, yeah. So, great question, Diane. So,
It's from all
So-
those years.
ways back, a lot of the police departments have collection locations.
Yep.
At one point, there used to be a sponsored prescription drug take back regional something. That I think like the DA used to sponsor and
Cape listed.
DEP and all this other stuff. Because people were disposing of like different prescription opioids and things like that at the police departments. Well, those things fill up. And so Great Barron actually had reached out to me saying that they had like multiple 55-gallon drum barrels of illegal prescription drugs with nowhere to take them. Because there's all these regulatory rules that you can't just throw prescription drugs in the back of my Toyota and drive it to the dump.
Mm.
Now Covanta, Eco, whatever name company out of Pittsfield, they used to be the incinerator company. They went out of business. Casella bought them. There's no place around that actually does like scheduled incineration. And so all the police departments were struggling in how to get these prescription drugs somewhere. And the closest places I think was Canaan, Connecticut. And so the collaborative with some of the resources that we have, I help pay and subsidize paying an officer to go around and collect all the prescription drugs, bring them to wherever and have them incinerated. And it kind of just got, our conversations going internally saying, look, like, maybe we should be doing this more often. Let's work with the police departments, let's work with the community, let's set up a system and let's do this routinely because we don't want this stuff out in the streets. We want to promote people to bringing them in, but when they get full, we don't want the police departments to reject, to reject it. Not that they would, but like, there's no place to put it. So we're working out some details on how to make something more of a comprehensive thing. Because you can't collect that at the household hazardous waste collection. These are like scheduled, controlled substances that you just can't.
Well, I remember doing the yearly ones every fall, and you used to have somebody from the Federal Drug and Tobacco Administration come. I remember coming them to Lenox, and they would put them in the back of their cars. They were agents that would come and take them. And then all of a sudden that fell apart.
So Patrick, well, first I'll ask the board if there's any questions, and if there's no concerns, I would entertain a motion to at least preliminarily approve the budget as presented, as I can submit it.
I have one question,
Sure.
maybe more later. the Southern Berkshire Health Collaborative, does it have a board?
It does have a governing board,
Okay,
and Diane Romeo was just recently elected chair.
okay, good.
Yeah, and there is representatives
I
from all.
remember that now from the last.
Yeah.
meeting. I didn't realize.
Yeah, and so we have intermunicipal agreements. It is a governing board. We usually meet monthly, although we may move to quarterly. Everything, it's all public meetings, one vote per town, but more the merrier. And I know CTSB puts it on, and it's a pretty,
Is that the Friday morning?
it's the Friday, yeah, yeah. December
I
was.
wasn't sure if that was a governing board or management.
It's really just a governing board of the collaborative, you know, each town has a voice. You know, we go through the budgets, we go through the work plan, we go through the collaborative priorities and. You know, similar to how Tri-Town is set up, we're trying to mentor these towns to take more onus on their own town and. They don't set. Like policies that usurp our towns, it's more just like. The collaborative, you know, the nursing program, we go through the vaccines, we talk about what do we want to do next year, and then the idea is that representative report back to each town and so on and so forth.
Well, I would make a motion to approve the budget as presented, noting the challenge with awaiting some of the employee expenses with regard to health insurance.
Is there a second?
So second.
All in favor?
Oh, John has a question.
I think Patrick, go ahead. You have a question on the subject?
Oh,
Hold on, you're on mute. Hold on. You're on mute still. Hold on, unmute yourself.
Hi there. I just wanted to comment on something you said earlier in the presentation, which is staff salaries were a cost of living increase of 2 to 2.5%. Is that what this budget reflects?
Yes,
Yeah, 2.4.
Okay, so last year inflation was 8%. This year is pegged at around 4.5%. The year before it was at 6%. And how you're budgeting is in line with how many municipalities are treating cost of living increases for employees. But I will just say in the last 3 years at 2%, in terms of real dollars, you've lost 12% of purchasing power on the backdrop of prices for homes in Stockbridge and Lee are up 100%, 89% in 5 years in Lee, over 100% in Stockbridge. And you talk about retention and staying competitive. And I would really urge the board to recognize that a 2% salary increase is not going to keep up in the environment that we've been in. And in fact, the employees of Tri-Town are falling behind with that kind of approach to budgeting. And I would suggest, and as somebody who will vote for your budget, I would support at the very least keeping in line with current inflation, if not trying to make up for what impact you had last year when inflation was at 8%. You know, folks are not keeping up. And the costs in our communities are even higher than a national average because of housing prices. Thank you.
Thank you, Patrick. Any more questions about Jim's updates about the budget? No. Okay, we'll move on to the next one. Jim, do you want to update us on that? What's happened since the EPA meeting that we had in November?
sure. A lot going on. We actually, the Lennox Board of Health met independently, and the Lennox Board of Health voted to submit public comments, which are due February 1st. And I know Charlie and I met with Parker Rodriguez, General Counsel for Housatonic Railroad, and Senator Mark a couple days ago to, really just talk about the February 1st deadline being this just weird date for deadlines for public comment, and the lack of, investigation and research on whether or not rail is feasible. It's my opinion, and I'm not a board member. I'm your employee, but when I look at the transportation plan, I've had time to digest it. It was really a missed opportunity by G and EPA to really spend money, like diving into the feasibility of rail. And so, there's a lot of things going on outside of the Tri-Town Board of Health, petitions and, there are people, advocacy groups that are joining, and I'm seeing a little bit of a movement in Lennox and, the Lee folks and, and when that transportation plan came out, I think it was an eye opener. When people started looking at that plan, missing tons of information on rail to begin with, seeing transportation routes seen in residential zones and, the thought and idea of diesel trucks driving down Main Street in the middle of summer or in the middle of a James Taylor concert, or God forbid, Christmas in downtown Stockbridge, coming up, 180 through 183. And so, like, it's just a missed opportunity. And it's not that I favor truck versus rail. It's missing important information. If information was sitting in front of the Tri-Town Boards of Health, and I don't speak for you, speak for yourselves, and you dove into that transportation plan and you looked at the data and the number of trips and the, greenhouse gases and emission standards, you can make a calculated, you can have a calculated conversation and advocacy on one versus the other. And look at it, if the study was done that rail isn't feasible and truck was the only feasible option, well, then that's an educated decision that this board could make or advocate for. It's just missing a lot, they've completely missed the boat. And in a project of this magnitude, that's gonna take 13 plus years. When we see projects like this, millions and millions of dollars go into, these kind of studies. And, in my opinion, when G or whoever says, well, the high concentration PCBs are gonna be, either trucked out or by rail, it's going to a location that doesn't have any rail infrastructure. Well, maybe they cherry pick locations that don't have rail infrastructure. Maybe there are locations that will accept the high concentration PCBs in the Northeast that do have rail infrastructure. And when I look at some of the maps that Housatonic Railroad put in, other than I think the Glendale Reach area, they all have somewhat of a rail infrastructure.
Mm.
And so, it's missing a lot of information. So we have advocated to Senator Mark the other day, help us figure out a way. Could you advocate and maybe extend the deadline to give time for somebody to maybe do a study on rail and then give us that information? And so nothing was promised and nothing came out of, just we're advocating and, the Tri-Town Boards of Health are advocating, we're demanding, we're asking for information. It's just, for me, it's and then at the lead meeting, I wasn't there in person, but I was there virtually. I thought it was a pathetic attempt of a presentation. Those are my words, not the board's words. It's just, I thought they missed the boat completely on this rail study. Whoever presented, GE, EPA, whoever, not Lee, Lee. And I do feel though, with all this sort of divisiveness, the litigation is somewhat settled. I do feel that there's more unity happening. I feel like all towns, I read something in the paper that Great Barrington said something, Lennox said something, we know where Lee stands. I think there's more unity than separation on the potential rail. And I think now is the time for the 5 towns to get together, get on the same page and deal with this now. Well, I don't want to be waiting 13 years down the road. Oh, it's not going to be built for a while. We got time. Well, I'm willing to bet if that transportation plan came out during the closed door discussions, that agreement wouldn't have been signed. It was signed without any of this other information. And so that's sort of like where we're at. I'll turn it over to, sorry, but that was my diatribe.
Didn't the Sonic Railway representative say it was feasible?
Well, yeah, I mean,
Yeah.
I mean, obviously it's an investment, but I mean, they said it was doable.
well,
Well,
yeah,
Yeah, I think, they were very conservative about what they said, so for example, the cost benefit analysis hasn't been done. You know, that would allow somebody to make, a definitive statement that something was feasible. However, at least my understanding from what, Parker Rodriguez said is that the rail doesn't see any problem doing it and thinks that it would be cost effective in the long run. And that although there would be some initial startup costs with the staging, the rail staging, that the long-term transportation savings monetarily and also in terms of greenhouse gases and environmental impacts of using the rail has been shown across the country to be preferable for the transportation of this kind of stuff to trucks in many circumstances. So he would anticipate that. And, I think, what we made very clear at our last meeting is that a lot of us had concerns about the trucks, but that I think we were also concerned that we didn't have enough information to really make a determination yet. I for one, if I saw a really well thought out comparative analysis of trucks and rail and it showed that trucks were better, I would accept the trucks. I would have to see that. But my impression so far has been that that there's been an assumption that it's going to be trucks to the exclusion of any kind of real responsible inquiry into the rail.
That's probably
And so
because of the cost, right?
This is why GE, for example, at his presentation in Lee, said that there wasn't any staging existing where they were going to do the excavation for rail. And so therefore they would have to use the existing rail station that was located at various places. And they would therefore, because that was not where they wanted to excavate the material, they'd have to use trucks to get to those places. Now, GE didn't mention the fact that there isn't any, that in the first place, from what I understand from talking to Parker Rodriguez, the footprint for the rail staging, that any of the excavation points would not require much different infrastructure or area than for the trucks. Except that you'd have to bring in rail and put it on top, and the railroad would bring in that rail. And what GE omitted, for example, in terms of being a balanced presentation, is that it never said that there's no staging areas for the trucks in any of the excavation places either. Okay, there's no staging areas for trucks or rail, but all GE said was that there was no staging areas for rail, and so you have to use these things further along. That was one idea. The second idea is the idea that in reviewing the 2016 permit and then the later 2020 permit, EPA, and this was at the behest of the Commonwealth, said initially in 2016 said everything should be put in rail. And as a carryover to that, even in the 2020 final permit, EPA says that the GE should consider should consider measures that would make more practical to maximize the out of sight, out of county transportation by rail of the PCBs. And the single most practicable measure that increases that maximizes the out of state transfer by rail is to put staging in place for the local transfer. Because once you have that local staging in place, you can use that same staging to go out of state for the other stuff. In addition to that, since 10% of the stuff was predicted to a minimum of 10% was predicted to go out of state, this means then that if you put rail staging in place for all of the material, you cut the cost for the out of state transport by a factor of 10. So it's a measure, and GE didn't even consider that in the presentation. So I think that, well, as I said, I think that my feeling, listening to everybody, the last time we had the meeting is that we wanted more information. That was the thrust of John's thing in the first place. And we're really looking to get a better educational process. So I believe that Senator Mark listened to us. He heard us, and I think that he understands that a more balanced presentation is what's necessary before we can go forward and make any definitive statements. That's my impression. Now, I don't mean to preclude anybody saying that we should make a definitive statement now. That's just my feeling now. But I would just to segue out of being too long-winded here. Diane, did I hear Jim right to say that the Lennox board had decided to make a statement, a public
We said
statement?
we would, meet again in January to look it over and possibly write a letter.
Oh, that's, do you have any idea, did you come up with any wording yet, or have you
Nope.
thought about that?
That's our homework assignment until we meet in January.
Well, I'd be very happy
help?
to see that, and I don't know if I can help, I'd be happy to see it. And it might serve as a guideline for our board, you know, to do it. I don't know if you want to consider yourselves to be a subcommittee in that regard, but I think certainly if you'd be happy to, you wouldn't mind presenting your point of view, we might be able to adopt it or you know, at least discuss it. I would welcome it.
Yes, that's something I've been tasked to throw a draft together for the Lennox board. I got, you know, info from Noel and John and Diane separately, and you know, without having a lot of data, I think noise pollution, greenhouse gases, emissions, and potential emergency concerns are probably the three public health things that we would probably focus on for public comment. You know, we know, yeah, second, you know, we know from EPA's own mouth that there's a 75% reduction in emissions using rail versus trucks from their own information.
Well, is there anybody else on the board that would be interested in having our Tri-Town board put forth a statement that might be prompted by the Lennox board's ideas?
I think that's a great idea, Charlie.
Thank you, John.
I would rely on the two. You are all much more knowledgeable of this than I. But however I could be a participant with you, I'd like to. If I may say one other thing, what you were saying about we shouldn't be worried about the cost of it. That's not our problem. And the things I'm looking at, and I may be wrong again, I don't have access as you have, Charlie, to thousands of pages and articles. But to talk about air pollution and talk about efficiency is great. But rail is 10 times safer than truck in terms of pedestrian safety. You take a look at rail accidents versus truck accidents. It's significant over this last decade. How many more people die from truck-related incidents than rail? The rail gets a lot of notoriety because they're dramatic. But I think we should emphasize that, you know, the safety of our residents isn't just because of infrastructure, but of fatal car accidents hitting a truck. With 58,000 truck trips, even at a rate of 0.5%, over 10 years, we're talking about a lot of accidents, a lot of fatalities that fall on our population. And I think if you do it during the holidays or during tourist seasons, those risks go even higher. And I think the rail, you know, can be talked about in terms of public safety from that aspect. So nothing. I know that if there's a spill, they know what to do. But I don't want to give credit to an arsonist who can put out his fire. I'd rather not see it. And I can assure you that if there is an accident, people in that area will suffer emotionally and psychologically from a spill. I don't care how safe it is. People will feel the effects of it if it happens in their yard, near their children, or near their school.
You know, the mental, we talked about this with Senator Mark the other day, and we've talked about this before. You know, we work with Briggs to do a post-pandemic, you know, session, and you know, the mental health and social mental toll is real. You know, whether people agree or disagree with people's comments and stance and viewpoints, the stress in the mental health is real. The anxiety knowing that you live next to a dump, knowing that you don't support the dump. You know, there's different ways to communicate, but like something I sensed a while ago, even during the pandemic, like, you know, we all suffer mental health in our own way. And it's really exponential increase since the pandemic. Then you add the stress of just thinking, you know, the toll mentally it is real on our residents, and we need to take that in perspective as well, because, you know, no matter how divisive, you know, some of these meetings are, and, you know, people have their own perspectives, a different way of communicating. Like, one thing I kind of came out, you know, doing the Leah adjudicatory hearing and all that, and, you know, the pandemic, and I see it every day. The toll on our residents is real.
Mhm.
And whether Dean Tagliaferro says he's gonna rub low concentrated PCDs all over his body and stuff, well, you do that, you do you, and but you know, like, but like if the truck gets T-boned by Morris Elementary, the stress is real. Whether or not we agree that the exposure is so low, it's not gonna affect anybody, we're not ingesting it. But just seeing trucks and the toll in the tourist economy and in the Berkshires, people buy, wealthy people are investing in our community because of the environmental tourist economy. And like, I just can't visualize downtown Lee in the middle of summer or spring when the weather breaks and people are eating outside, getting fresh air, you know, being subjected to noise pollution, greenhouse gases, emissions, you know, idling on Main Street because of, you know, because traffic is brutal off exit 2, and like, just the mental health stress is real, and we don't know how people are going to react when this thing starts to happen.
Well, you know, it's an interesting point. I hadn't thought about this before, but you know, the EPA has been extremely thorough in terms of they have what they call performance standards. So, for example, they'll look at PCB concentrations, and they've done an incredible amount of research looking at how many people fish, whether they eat the fish, looking at you know, whether they picnic, whether they canoe, and then they've determined what they call performance standards, which are acceptable levels of PCB concentrations in the environments where these various activities would be anticipated to take place. And that then sets the standard for how they have to remediate it to get those levels within those standards, so that those people performing those activities aren't going to be suffering from cancer or some of the other diseases that they were looking at. When you look back through their documents, it's a very thorough study, but there is really no study of our towns and the possible ill effects on the health of the people in our towns. They've spent all of this time and effort looking at what's going to happen in the river and in the floodplain, in the various areas around the river that have been contaminated. But they haven't taken one look at where they're asking to have these trucks go. They haven't looked to see, for example, I happen to know from talking to the DEP that there are several hundred places away from the GE property that have been identified by the DEP as having PCB contamination from the GE exportation of the material. And subsequently, some of these places needed to be remediated. Now, I've heard, I mean, there are rumors that there are a couple of places in Stockbridge where these drums with transformer fluid have been dumped. And there's just another thing so that the estimate that they have that a certain level would be acceptable if there was a spill or whatever is predicated on the idea that there's no other PCBs in our environment. They're working on the assumption that our towns don't have any PCBs from any of those areas, and it's quite possible we don't. I don't know that we do, but they haven't looked at that. So they're proposing something without doing the same level of homework that they did for the health risks of the PCBs in the river. Similarly, they've never brought up, for example, in Massachusetts, the Berkshire County has had for the last decade either the highest per capita motor vehicle fatality rate or the second highest per capita fatality rate. And I'm not sure why that is, but that is the case. And they haven't looked at they haven't studied or given us the data on why that would be the case and how that would factor into having trucks on the road. So I'd like to see from them, before they propose this, a much more thorough investigation of our communities, sort of like what they did in the river.
Correct me if I'm wrong, but I think that there's supposed to be another step for their evaluations to start including social and geographic.
There was something in the paper yesterday on that.
Yeah. That there's another step, which sounds like it might address some of the issues.
And mental health, for example, which would be another aspect of it that hasn't been covered. Well, the thing is that compared to the other things that they've done, they're putting the cart before the horse. Whereas originally they studied all of these things and then they determined what they should do after their analysis. Now they seem to have decided they're going to use the trucks, and now they're going to justify it by whatever they do. It does seem to be a different order from what they've done. And I'm concerned that they've given us a deadline, February the 1st, that doesn't allow for, if the railroad, for example, is supposed to put in a public comment or public input, that, as far as I know, they haven't contacted the railroad or gone out of their way to do that. But if the railroad or some other arm's length entity were going to do this, we won't have a chance to have a meeting to look at this. The public won't be able to discuss this the way they did in the past. So there are a lot of things about it that I would think having an increased time frame would be useful.
I mean, what kind of time frame? The feasibility of rail versus truck has so many moving parts that it will take a lot longer than February 1st. I think practically the best we might be able to influence is the requirement that, or, ask for, demand, whatever the right verb is, the requirement to more thoroughly investigate many of those characteristics you mentioned, the ability to acquire land, which they'd often have to do for the pad for the truck anyway, as you had brought up, et cetera. But it would be difficult to put together all of that sort of appropriate data, including any public health data about increasing truck traffic. So February, maybe extending the deadline, I'm not against that, but it can't be extended far enough to have that exact answer. It may take a year to find out, is property available, at what cost, et cetera. As much as I don't want the cost to be a factor, it's going to have to be part of the logistics of acquiring that data and the important logistics, just with infrastructure and with sort of physics of moving this stuff one side of the river or not at various areas, some short distance trucking, et cetera. So, I mean, certainly asking for an extension to July 1st or something like that would make some sense, but it also makes sense to insist upon a more thorough analysis.
Yes, absolutely. The time factor is another factor that I think was misrepresented by General Electric. So they mentioned the fact that the railroad would be subject to delays because of scheduling, whereas the trucks wouldn't be subject to delays. Now, anybody who's driven through the towns of Lee, Lennox, or Stockbridge in the summertime or whatever, is going to, or if there's Tanglewood going on or something, realizes that the trucks are going to be delayed too, at least with the routes that they're proposing doing. And if the truckers are then, in order to maintain their schedule, going to go off route into some of our other neighborhoods, which is, somebody brought that up, that wouldn't be such a good idea. But the other part of it that I think is very interesting that they haven't looked at, and this is why their lack of an intensive analysis is a shortcoming of another degree. And that is that Mr. Taliaferro has urged us to not delay the discussions, to get the project going because there's already been enough delay. Now, that's one of his points. But I'm not a railroad expert. But I've been looking at a lot of different rail situations, and it seems to me that if everything were put on rail and moved out of state the way the EPA originally was going to do it, it would be faster by several years than this 13-year program that they're looking at. And that and again, I'm not a rail expert, but what I would say is that the lack of an analysis doesn't allow us to know whether that's the case or not. But I strongly suspect that once all of that rail staging is in place, that it doesn't even, that a lot of it won't even have to be moved to the UDF. There's no minimum requirement for an amount of material that has to be placed in the UDF. The minimum requirement is that a minimum amount of material must be transported out of state. That's a minimum. It has to be at least 100,000 cubic yards. Pardon me?
The higher concentrations.
Well, it doesn't
And the lower
stipulate that
concentrations
specifically,
will
but I
stay
think
locally.
that's implicit, but it doesn't stipulate that as far as I know. But yeah, it's about 100,000 cubic yards is a minimum. And then the second stipulation is that EPA says that GE should try to maximize the rail transport out of state. Now, when you put those two things together, and then you put together another point, which is that there is no minimum amount of material specified to go in the UDF. GE can make the UDF and nobody has to put anything into it. And GE is still obligated to fulfill what's going on. The logical thing I see is to pump hydraulically from Woods Pond into the UDF and ship everything out by rail. And we get the job done in half the time. I bet. Please.
I want to go back to a discussion about some sort of letter. Lennox was proposing and had asked for some help in drafting. Then I overheard kind of informally that Stockbridge may join on to that letter. I'm not sure what the letter's intent or content is proposed to be. Is it a request of the EPA that they consider rail or what?
We're not
Because we
sure.
haven't talked about it and it might be
Yeah.
something the lead board would talk about.
I
And see if there's.
So I
The
think,
Stockbridge board hasn't discussed.
yeah,
it.
so, I mean,
Well, it came up just partially.
yeah, so the board can make a motion tonight to do something actionable, because it's not really on the agenda per se. So the Lennox Board of Health met, it was specific on their agenda, and the Lennox Board decided, tasked me to try to come up with some general statements in preparation for the public comment to be submitted, to, really focus on greenhouse gases emission, noise pollution, without a lot of detail and data to present it. And I'm gonna present a draft to the Lennox board early January, if they're okay with that. So we're
So,
gonna just send in public comments. And I think what I would probably suggest is that the Lee board, we convene a Lee Board of Health and a Stockbridge Board of Health independently and see if that's something similar. And then we could always, the Tri-Town Board of Health could reconvene sometime in January before the public comment with a draft. I can propose like similar drafts, or something like that. And then, the Lennox, each Board of Health can independently submit public comments, but the Tri-Town Board of Health can do the same thing. It doesn't have to be one or the other. It can be both.
okay.
I think there's, we talked about this in Lennox last week or whatever, that there's value having a Tri-Town Board of Health letter, because EPA and G know Tri-Town, they know us for a lot. Well, they know the Lee Board of Health too, but I think the more
Might carry more weight.
public comments submitted, the better, but we can't vote on something specific tonight for
Right.
Tri-Town, but I think, I should reach out to you
Okay.
and Charlie, and Stockbridge has to meet sometime in early January anyway. And my plan was to put that on the agenda. So there is time to kind of sort through the logistics of that.
Okay.
Don't ask me what the letter's gonna look like. I haven't wrote it yet.
But the overall intent or proposed the potential is a document to come from either boards of health or possibly Tri-Town that is part of that is added to the public comment library.
Yes.
Correct.
Advocating for, well, whatever we'd be advocating for, but primarily higher consideration, from my view, would be increased information and data gathering around the use of it. So, okay,
Yeah.
that makes sense. I didn't know. Yeah. That makes
So we
sense.
should
Because
probably-
if we're gonna talk about it, I wanted to get a clear idea of what Tri-Town may be leaning for.
Yeah.
And what Lee's role would be in that, but we'll definitely talk about it and
I think what I can do as the staff member, before the holiday break, I'll reach out to Lee, get some potential dates. I still gotta work with Lennox and Stockbridge has to meet anyway on a subdivision issue, and we should probably.
So should we
Think about
put
that.
that on our agenda for the next time is
Yeah.
to discuss a letter by Tri-Town?
I think we should set a date.
Right.
So we should be meeting before February. We need to
Yeah,
know at the end of
before
January,
February.
we gotta get that letter in.
Yeah.
Just as being on record. We wanted to be able to be on record as having commented during the public period that we are really concerned for the lack of information and how it's gonna affect all of our residents. I'm really worried about the mental health, because people come up to you in the streets and, my kid goes to Mars, what if something, I mean, parents are panicked.
yeah,
They're
absolutely.
purely panicked. And Jim was right, nobody really thought much about it from Stockbridge or Lennox because we weren't in the fight and being knowledgeable. Once that public record came out, people started reading it. Oh my goodness. Here we sit.
Citizens, but I move on to citizens speak.
Okay, all right, if any more discussion of the updates that Jim just put forward there? If not, I'm gonna open up citizen speak time. Jim, do you want to manage that?
Sure, anyone wants to speak during public comment, just state your name and address for the record and ask people to try to limit, there's so many people here. Limit your time to 3 minutes if you could. Yeah, go ahead.
My name is Julia Thomas and I live in Monterey. My address 72 Fairtown Mountain Road. And I was here at the last meeting as well, and have been working on kind of organizing people of my generation around this issue, as well as, just kind of mobilizing voices who previously had engaged on this topic. And so I formed a sort of action group with 2 other people, Jared Weber and Phoenix Haynes of Lennox, and we're called the Clean Berkshire Collective. And we are working on a letter as well to kind of distribute and get co-signatures from as many regular citizens as we can. So this has been super helpful, and because we wanted to be, aligned with what you all and the towns are saying. And I thought maybe you and I could share notes or something, if I could share with you what I'm thinking based on some of what, you guys have shared here. We wanted to be reflective of, kind of, I guess, unified, because that's also, I think, the feedback that Dean, or, one kind of guidance piece that he gave at that last meeting was that the more that feedback can be kind of coordinated and the same weight it will carry. So yeah, I'd love to coordinate with you if possible. And also, I think having a letter from the Tri-Town as well as the 3 towns, in tandem. So, yeah, thank you.
So do you want to speak?
My name's Steve Turner, I'm from Lennox, and I just encourage you to go after this flawed plan. And the dump if you could. But you're right, it's not well thought out. That's what I'm concerned.
I think we lost a lot of our participants, but is there anyone on Zoom that would like to raise their hand and speak during public comment, you can just throw your hand up in your reactions area, or you can take the liberty to unmute yourself. There's a bunch of people still on here. It's surprising.
Oh.
Anyone?
Oh, there's something.
Debbie, if you want to speak, just unmute yourself.
Hi, I think I'm unmuted. Can you hear me? I'm Debbie Kelly from Lennox. I just really wanted to thank the board for the consideration that they're doing with the transportation plan. You know, this whole thing has been really upsetting to me from the announcement of the toxic waste dump in Lee. So I really appreciate the thought that you're putting into it. I wrote down a lot of things for my own comments. I appreciate that you brought up tonight about just the stress and anxiety on people that live in Berkshire County and what we've been going through trying to deal with this. So anyway, I just want to say that I appreciate your actions with this whole thing. Thank you.
Thank you. Anybody else? Anita, did you have your hand up? Maybe not. I don't see any hands up. I'll going once, going twice, begging for public comment.
So,
All right, so I think
Okay, I think,
that's it.
all right, so we'll close the public comment period. Does anybody else have anything else that needs to be discussed, or would somebody like to make a motion to adjourn?
I would like to make a motion.
A second?
Second.
All in favor?
Aye.
Okay, good night, everybody.
Thanks, everyone.
Have a nice.